So I'm going to hit the record button. Okay, welcome everyone. I'd officially like to say welcome to our first Q&A panel. We're very excited to have you on board, and the objective of today's session is to show you how we can connect as allied health services through telepractice and how it can be successful and how we can help continue services to our clients or anyone out there for those important therapy outcomes so you continually be able to gain and achieve your goals. So a big thank you for everyone. This session will go for about an hour. We will have question time at the end, so please continue to write questions in the Q&A box down the bottom or send through a chat through the chat room, and we'll get to your questions at the end. We'll also be sharing a copy of this presentation with you, and we'll be uploading it to our website along with all the other resources that we have. So I'm going to share our PowerPoint presentation with you. Okay. Share. Okay. Can everyone see that?
Not quite yet. There it is.
Okay, so it's loaded. So great. Okay, so we're going to run through this PowerPoint presentation. And first of all, I'd like you to be introduced to the panelists. There's myself, Beth Gwalter. I'm a founder and one of the directors, along with Lisa Nolan, and I'm an occupational therapist. So my focus these days is really on our client services and making sure that we're providing a high quality service to our participants and our referral partners. Aimee, would you like to introduce yourself?
Yes, so my name's Aimee Prosser. I'm the Clinical Operations Manager for Recovery Station. So I look after the 5 disciplines. So we've got physiotherapy, exercise physiology, we've got speech pathology and dietetics, and then we've got occupational therapy, including mental health OT, driver training OT, and complex home modifications OT. So I look after all the different teams, as well as having then my clinical background in occupational therapy, as well as mental health occupational therapy and a neurosciences area of interest. So I've been in OT for 19 years and been with Recovery Station for nearly 6 years now.
Good morning. I'm Nicole Byrne. I'm a senior speech pathologist, so one of a number of speech pathologists, part of the team in the Hunter in Sydney and on the Central Coast. I've been a speech pathologist for nearly 30 years and have experience across hospital services, rehabilitation services, neurological caseloads, and at the moment also doing a lot of work in the area of disability services and with the community.
Great, thank you. Thank you, panelists. And now I have the pleasure of introducing you to our team. This is half of our team. This is in the Hunter. This is pre-COVID-19 days when we could group together for a photo. As Aimee explained, these are the disciplines that we provide. We've been in the community for 15 years. We see over 2,000 NDIS participants. We have aged care participants. We see private clients in the community. We see some of the most complex cases for disability and conditions in our communities. And we have a very experienced team with a lot of knowledge. There's no, very few referrals that we can't take on board. Okay, so to get things started, I'm going to play a little video. This is Barry. He's one of our clients. He's actually a veteran client of ours. So he volunteered to help us with this video last week. So I'm just going to press play. Hi, my name is Beth Gwalter. I'm a founder and director of Recovery Station. During our 15 years, we have had a lot of experience with telepractice, and now at this time, as allied health providers of essential services, telepractice is really coming to the fore. Just because we're physically isolated at this time does not mean we need to be socially isolated. We have made it very easy for clients to contact us so we can help set up their telepractice session. It's easier than people think and they are pleasantly surprised. All you need is a phone or a video connection so we can connect with you. You'll also be happy to know that there's some great benefits with telepractice. One of them is that there's no travel requirement, so there's no expensive travel costs, which means there's more time to be spent providing you with a therapy that's going to make a difference. You can also stay connected with essential healthcare services in the comfort of your own home. Therapy that keeps fit and boosts your immunity to keep you out of hospital. It also helps you maintain your well-being, your independence at home, whilst helping curb the spread of the coronavirus. At Recovery Station, we have a team of dedicated team coordinators who help our clinicians and also help you. So they will spend the time with you to help you set up the telepractice session. You may even need a trial run and want to practice with them, or we can get your clinician to give you a free trial for your session.
Hi, Carrie.
Sorry, everyone.
How are you today?
Hi, my name is Dr. David Oliver, I'm a chiropractor, and today what we're going to talk to you about is forward head posture. Forward head posture is basically anytime you...
Let's get rid of him. We'll go back to Barry. Okay. Actually, coming into your home to do assessments for home modifications, swallowing assessments, or doing other types of therapy.
Excellent. That's a nice height for your eyes. Get in and out of that chair.
Oh, it's very nice, really. Good work, buddy. How are you going there, Alan? All right, you're looking great. Excellent. Once you've done about 6 each way, have a little break for me and have another drink of water.
Because we're physically isolated at this time does not mean we need to be socially isolated. All you need is a phone or a video connection so we can connect with you. Okay, sorry about that little interruption there. So as you can see, there are a lot of benefits to telepractice. Let me just move on to the next slide here. Okay, there, I got it. So we went through a lot of the benefits in the video right now, just now. We've got these also on our website. I think it's obvious that, you know, the main reason why we're at this stage is to curb the spread of the coronavirus, and telepractice is the ultimate way that we can do that. Of course, what we set up for telepractice for clients is tailored to the individual's needs. One of the great benefits is that we can use what people would have otherwise put towards travel to therapy to help people achieve their goals and outcomes even more. Okay, so what is needed for practice? So what does a client need? So first of all, the most ideal situation is if we can connect with people via video link. For that, they need a camera with a computer with a camera, or they can use an iPad or a smartphone, and of course they must have internet access. So a stable internet connection is very helpful, and otherwise we can conduct sessions over the phone if it is appropriate. It is best if the environment is quiet. We understand at this time with a lot of people in the houses that It's not always possible, but we can always try our best. There's also different therapy resources that are required that the therapist will go through with the client beforehand. They could be everyday items that people can use around the home, or we could send them things like TheraBand for their physiotherapy sessions. Often a second person is required. They can be the hands, the eyes, the ears of that person requiring the therapy. Often with the complex nature of the clients that we do serve, having that extra person is necessary. So we also discuss this before we continue with our session. So now I'm going to hand you over to Aimee, who's going to talk about how the session will be run.
Okay, so often what we're finding is for a lot of our clients, they're not all that familiar with using telepractice. So especially prior to our first telepractice session with clients, what we tend to do is actually contact the participant or their key contact person to discuss how we're going to use telepractice and gauge what's best for them. So how we're going to actually do that, either via phone or via Zoom. And depending on their technology or skill levels, we can actually arrange a trial session beforehand or contact them in the 15 minutes prior to their session time to talk them through step by step. If we've got somebody who's quite technologically savvy, we at arranging the appointment can actually send them the link then if we're going to do it via Zoom, and we can know then that they will actually click on the link and open up their session time at the appropriate time. However, for a lot of our clients, for the first 1 to 2 sessions, we'll actually phone them and talk them through the steps. For some of them, this will mean actually downloading Zoom for the first time during that first session. So we'll contact them 15 minutes prior to, give them the phone call and say, okay, can you open your email? I've sent you through the link. When you click on that, it will ask you to download Zoom. We're going to do this together and I'll talk you through step by step. So I'll be sitting on the other end of the phone while the client's got the computer open in front of them or their contact person, and we'll actually go through it nice and slowly, step by step, so they're not feeling confronted or too overwhelmed with all of the processes. So basically, once we've got into that routine and they know what they need to be doing, it will be making the usual appointment time. They'll be sent a link with the Zoom, if we're going to be doing it via Zoom, the Zoom link for them to click on. These are generated with individual and unique meeting numbers so that it's not the same number used over and over again. That's part of the data security. So, and then that email is just what needs to be clicked on each time to open the session. And then you actually complete the session and begin with the trained telepractice therapist. Some of the sessions, if we need to record a portion of the session, we can actually do that, but that's with the permission from the client, and we actually need to clearly request permission from the client or their person responsible during that session to record that specific component of the session, and that's only if we're doing that in order to assist meeting therapy goals. So if we're going to be sending a particular exercise to the client to repeat over and over again as part of their ongoing home-based program. At the end of the session, we then arrange for the follow-up appointment as per normal, and then we can send the link through for the next session for the client. So it's basically repeating exactly what we would usually do. So at the moment, we're tending to find that Zoom has the highest level of reliability, video and sound quality. It also meets the internet safety and privacy requirements. It's quick and easy to download on the computer or smart device, and we're willing to work with the client on whatever is the best platform for them. For some clients, they won't have this availability, and we're doing this over the phone. So we're completing a phone-based consultation and finding that is working equally as well. We're willing to do whatever it takes in order to make the transition as smooth and seamless and comfortable and comforting for the client during this time.
Thank you, Aimee. And before Nick jumps in, I just wanted to let you know that we're continually developing telepractice resources and uploading them to our website every week. For example, we've just uploaded this telepractice troubleshooting guide for clients. Okay, Nick?
So as you would have already seen, we're really committed to making sure that telepractice does work with our participants. and we're working individually still with the clients around meeting their own goals. So some of the strategies we have on the screen of ways that we can make the telepractice work for the individual person. So it might be sharing our screen with them. So as you've seen, Beth is sharing her screen with the participants in our webinar. We can also share our screens with the clients. And so this might allow us to show the client a list of exercises, or yesterday I was working with a client with a voice disorder, and I put up on my screen the list of words for the client to practice, and then I could modify them as we went along, and then email that list back out for the client to, then continue on as home practice. As Aimee's mentioned, we can record the session or record small sections of the session, which might be when we're working through some exercises with the client to enable them to remember what they need to do when they're practicing at home, in the time between sessions. We can take screenshots of our screens. So some of the applications will allow us to use a whiteboard function, which we might be writing down instructions or giving the client examples. We can also use online apps to engage the client. And everyday items can be used. So this provides a fantastic opportunity for us as therapists to work with the client in their everyday setting and use what they have around them. So if we're working on some naming tasks, we can get them to be naming items that they can see in the room, or occupational therapists might be working on some fine motor skills and getting them to pick up pens, paper, tongs, things that are just in their kitchen. We work with the client to try and get the best picture so that they can see our faces and see our facial expressions. So it might be talking to them about the lighting behind, using different cameras, being able to zoom in on the pictures.
Great.
So as also mentioned, often we might need a second person in the room. In particular, if someone does have a communication problem, they might have some difficulty, setting up the Zoom meeting, and they might need someone to act as a support person with their communication. As I mentioned, the tools of allowing us to share resources and access online apps and whiteboards means that we can, in effect, use the computer screen itself as a communication chart, and the client might be able to, circle the word or circle the letter that they're trying to use. The chat function provides a fantastic opportunity for clients to engage in written communication. So an example was I used that function yesterday with a young guy who doesn't particularly like doing some of the naming tasks, but when I asked him to put them in the chat function, he was like, oh, fantastic. And, he did an excellent job, but, he actually is not particularly keen on, writing in the clinic, but doing the session from his bedroom, sitting on his bed and, typing in the chat function, he was so much more engaged and interested, which is great. The chat function might be helpful for some clients that have hearing impairments. Another big advantage of Zoom is that we can link in multiple people into the meeting. So as you've seen now, so it means that we can have interpreters or other support people or family members that may actually join part of the session as needed. Being able to use resources and visual aids by sharing the screen, really helps us to be able to explain to the client, what we're, the information that we're trying to give them.
Okay. Thank you, Nick. Over to you, Aimee.
Okay, so I'm just going to have a quick chat to you about some of the physiotherapy and exercise physiology group and individual sessions that we've got set up. So this is Kerry in our picture here, and you can see how she's been set up to run one of our Pilates groups. I believe that one is there. So basically we've set up our clinic to enable both group and individual exercise sessions to be completed via telepractice. It means that the client can be at home and have a full view of the clinician, be it a physio or an EP. And it means that the therapist can actually see multiple clients in their home, projected up on our big screen there as well. So it's basically as if they're still in front of their class, which is excellent. It's basically like having those old aerobics Oz style videos happening, but it's like they can see you through their TV screen and you can see them. So it's amazing. It's really, really good. And it's still allowing the clients at home to connect with other clients that they would have normally been seeing in our classes. So we would normally have been running multiple classes every week, and we're going to be having a virtual class timetable up on our website very shortly as well. So for a lot of our clients, this was a really big part of connecting with their social group coming into classes. So having that not be possible during this COVID-19 period has been a really big change in their social connectedness as well as their physical fitness. It's been a loss of meaningful activity and part of their routine. So being able to provide virtual classes for them where they can still connect with other people and see other people on their screen, it's been really important and amazing, and they're able to talk to other people as well through the class. So we've also mailed out basic resources to clients, including weights, TheraBands, rice bags, things like that, so that they can continue completing both individual one-on-one exercise classes with therapists in this way, as well as doing group exercises like our strength, our supervised gym, PD Warrior, Pilates, and we've got a whole timetable that we're working on at the minute to offer a broad and diverse range of group sessions, not just from physio and ex-phys, but also from our OT and our speech therapists. So we're going to be offering a big, broad, diverse range of activities there from group and individuals. So next, if we have a look at how the physios and EPs are working one-on-one with clients in their home, you can see Barry again here. It's looking at how we can utilise the home environment and what the clients already have within their homes. So most clients will have some area of space where they could be holding on to a chair, a kitchen bench, a table, that kind of thing, and using that for additional balance and support. We can also look at, again, the assistance of a second person if we've got a support worker or a regular carer, or if we've got a family member, and asking them to be the spotter or providing additional support. We can also ask them to change the camera angle by moving, for example, the tablet, or moving the webcam, or moving the computer if we've got a laptop, that kind of thing. Because sometimes what we need is to just change the angles during some assessment components, just to ensure we're getting a full range of vision and a full visual scope. That gives us better accuracy if we're looking at things like range of movement, posture, gait, all of those sorts of things. So a lot of what the physiotherapists and exercise physiologists do in their role is not necessarily just manipulative hands-on therapy. A lot of it is based around education, a lot of it's based around motivation, a lot of it's based around observation. So they can do all of those things via the phone and via these telepractice sessions, and they are doing that very successfully at the moment via telepractice. And a lot of our clients are actually finding it's allowing them to do more frequent sessions, and it's keeping them more motivated to do their home exercise program, because suddenly the EP and the physio is in their home and says, oh, you've got the perfect space to be doing this just there. Let's practice it together. So it's really working very well. So they're doing things like balance, strength, core exercises, range of movement, stretching, all of the above. So looking at our OT. So again, a large portion of our initial assessments even are discussion and information gathering. So for example, we go through everything from your day-to-day living activities to who supports you doing what, to symptoms and diagnostic information gathering. So a lot of that can all be completed via phone or via Zoom. So I've even done exercises with actually picking up the webcam, picking up the laptop, or picking up the tablet, and having a nice walk through a home to do a basic home environmental assessment over that medium. So we can observe functional tasks, for example, making a cup of tea, as Barry's doing here. We had a therapist the other day that did a lunch date with a client where the client prepared a meal, doing a basic meal prep, and then they sat down and had lunch together. So that was a fantastic use of telepractice. So we can do some simple functional transfers. As you saw, Barry on the video there was showing us how he was using a transfer technique to get in and out of bed, and then was provided with information on log rolling, lifting his legs down out of bed and pushing up. So we can do things like watching them using assistive technology and education on using assistive technology for safe transfer and improving functional ability. We can review range of movement, upper limb, all of those kinds of things, and we can complete specific assessments using shared screen and recording answers, by emailing things or mailing things out. That includes everything from our sensory profiles, our HUDAS assessments, our DAS-21s, the overt behaviour scales, all of the types of things that we're using for our SIL assessments as well. So when clients are going for their funding reviews, we can actually complete full SIL assessments and plan reviews via Telepractice. So the next slide, we are just talking about completing ongoing therapy sessions rather than just our assessment sessions. So again, a lot of what occupational therapists are focused on is about day-to-day living, functional activities. So we're better placed to complete functional activities than in your own home. So we're doing these retraining sessions using the home base, using home-based activity appliances, using the things that you have in your own home. We're making it as functional as we can. So using everyday items for fine and gross motor activities, you know, whether it be lifting and reaching for something in your cupboard, to counting the coins in your money box, to using the tongs, to cutting things out of a catalogue. There's many, many activities that we can do to use your task analysis and work on individual components of tasks that we can do via telepractice, and we can provide instruction and feedback on, that's going to make a huge difference and provide ongoing therapy. So sharing worksheets and therapy sheets on our Zoom screen, where we can upload files, we can email files, and we can send worksheets to clients, are all very good. Discussion with staff and support workers are all excellent. So we can also do things like completing range of movement education sessions with carers. We've done things like providing manual handling training, using both video sessions, our YouTube channel where we've got a lot of video education already uploaded. We can do all of that with carers over Zoom. And using other educational videos and demonstrating new techniques, and doing that in that repetitive, graded chaining and reverse chaining manner that we usually use for education sessions with clients. That's the way that we continue to do things. Okay, so moving on. We're looking at now some I'm jumping ahead. Home mods. So everyone tends to think home mods, which is a large core component of what OTs do, that home mods can really only be done in person. But depending on the participant's physical and cognitive abilities, and or the availability of a support worker or carer or family member, we can, and we have completed these home mod drawings, recommendations, etc. over Zoom and Telepractice. So you can see here how simple it can be to actually get a carer or someone else in the home, or even the client, if they're physically able to hold up a tape measure with some simple instructions, such as, I want you to put the metal end of it up against the wall where the cistern of the toilet is, and now I want you to run it out along towards the toilet roll holder. Okay, then I want you to take a photo so that I can see nice and clearly, or if they're holding their tablet, say, you can take a clear screenshot. That will give you some very clear measurements of how long a particular dimension is that you need. The same way with height. We've done this for many, many measurements with complex home mods and simple home mods, which you can then go out and verify. At this point, we are still able to do short home visits with all of our PPE in place. So with that in mind, often it's getting these measurements and then going out and doing a much faster, safer and secure double check process at the end rather than having to do a full length visit. So we can review transfers over telepractice. We can do lots of different things over telepractice. The next one here is about OT equipment prescription. So a lot of our equipment falls under level 1 or 2. So for anybody who has questions about the different levels of equipment, I'm happy to answer those later. So that means a lot of equipment can be selected by an OT based on their clinical experience and without requiring extensive trials and the AT equipment request form. And due to the limited complexity of the equipment, we might be able to prescribe it that way. If a trial is still required, it can be conducted either in person using our PPE, or it can be conducted with the supplier, with the OT on telepractice, providing feedback and observation and advice. And we've been completing several of these at the moment because of the new restrictions about the number of people that can be in an enclosed space and the social distancing. So often if we're in a lounge room trying to prescribe a piece of equipment, it is very difficult to maintain social distancing. We've got restrictions on the number of people that can be visiting somebody's home, those kinds of things. So it is important that we need to be using these options wherever we can. So a lot of our equipment suppliers have reached out to us and said, we are very happy to do virtual prescriptions. So if you set up the link, we'll go in and we'll take the photos, we'll talk to you via Zoom, we'll give you all the angles. We just want you to actually tell us what you want us to do while we're in there. And we're prepared to do that with them. So, and again, we're very happy to still be completing certain components of it using our PPE. So mental health OT has actually been using telepractice, phone consults, all of those sorts of things for quite a while now. This is not new. This is a service that has really transitioned so seamlessly over to telepractice. Assessment processes, gathering the information, building rapport, completing standardised assessments, using our shared screen and even just over the phone. This is quite natural for mental health services to be conducted in this way. So intervention often is including strategies to best manage our mental health symptoms. It can be everything from goal setting, identifying triggers, discussing calming strategies, implementing sensory strategies, emotional regulation, and motivational interviewing. And when you look at it, basically all of our CBT, DBT, ACT, all of the usual techniques that we have in our little tool bag of additional methods that we interweave amongst what we usually do, they can all be delivered verbally, so over the phone or via telepractice. So this is quite a natural and often quite a calming and less confrontational method of dealing with therapy for a lot of our clients. Nearly all of our mental health clients have accepted telepractice as being a very natural progression for them. So just looking over at the next page as well, what we're finding as well is that this is a really uncertain time, and managing any participant's stress or anxiety is really important. And as part of that, maintaining meaningful connections and connectedness and activities as part of a regular routine, and including therapy in part of their regular routine, and reducing that feeling of disconnectedness and of being lost or neglected is such a massive part of avoiding ongoing mental health issues or escalating existing mental health issues for many, many, many of our clients, that we really need to continue services as much as we can, even if it's the welfare check, if it's providing consistent activities that support workers can be doing with the clients, maintaining a regular routine pattern of intervention. It's about ensuring for these clients that even though they can't be connecting with their usual day program or social group, that all is not lost, that there is somebody there that's really caring for them and caring about them and still keeping something from the normal part of their day and their week and their life happening on an ongoing basis. And it mightn't be in the usual method, but it is still what they're used to, and the person that they're used to and the face that they're used to. So that's part of what telepractice is still providing for them. So, and then helping them to work through the stress and anxiety that has been really additional because of the fact that their other usual activities aren't continuing, and the fact that they are now potentially spending a lot longer in their home with their housemates that maybe they don't see all the time, or with their family, those kinds of things. So we're doing a lot more of that.
Wonderful. Thanks, Aimee. Now, Nick, if you'd like to take us through speech pathology and dietetic services.
Thank you. As you're all probably very aware, swallowing is very complex from a neurological, physiological, and structural perspective. It's something that we don't have to think about if we don't have any problems with swallowing, because it just happens naturally. But for someone who maybe has a swallowing difficulty because they have a neurological disease, which might be a Parkinson's disease or a stroke, or have dementia or some difficulties with sensation or oral surgery, for them swallowing can be very, very difficult. And because it is such a complex thing, at this point in time, we're still providing all of our swallowing assessments face-to-face. Our paramount concern is the safety of clients in regards to identifying the appropriate diet consistency for the person, for fluids and for food, and ensuring that we're reducing all of the risks to that client. So the risk of aspiration or the risk of obstruction or choking, which both can have life-threatening consequences. We've, as a speech pathology team and in consultation with the leadership team, we've undertaken extensive investigation of the research around telehealth, and in particular telehealth with swallowing. We've talked to key stakeholders and consulted, all the relevant policy documents from Speech Pathology Australia and other health agencies. And so using the evidence that is available to us at the moment, we've been able to determine that if it's a new client, we will still conduct the swallowing assessments face-to-face. And as Aimee's already mentioned, using our full protective equipment, which speech pathologists use just as part of our normal swallowing assessments in regards to gloves. And we also will have the additional use of face masks or face shields and gowns if those are required. So they would be for our new clients, but for some of our clients who are current clients and who are stable from a swallowing point of view, so it might be clients that have a mealtime management plan, that mealtime management plan is reviewed on an annual basis. They're one group of clients that we would be able to look at offering telehealth services. And this would require us to be working with that organisation around ensuring that we had a support person with that participant who had been suitably trained. Queensland Health actually has a training package for people to work with speech pathologists around telehealth in swallowing. And so this would be a training package that we would be talking to the organisations around their staff being trained, so then the speech pathologist can conduct that telehealth mealtime management review. In regards to swallowing therapy, that can continue as telehealth as well. So where speech pathologists would be providing education to carers or education to support workers or nursing staff, we can do that via telehealth, and we have been doing that. We can also do our regular check-ins with clients, how they're going in regards to their swallowing exercises, and watch them practicing their swallowing exercises, through telehealth, and providing them with that immediate feedback in regards to their positioning, in regards to how long they're holding the exercises or the number of repetitions. We can also work with clients and their carers and other people such as kitchen staff around diet consistency. So, providing videos, or us, showing people how to thicken fluids, or how to puree foods, or us having a look at the food that's being provided to a client over the video. So there's still many ways that we can work with our participants around swallowing through telehealth. Move to the next slide. Speech pathologists are able to conduct the majority of speech pathology interventions over telehealth. So we are working with clients who have language difficulties, and those language difficulties can actually be worked quite well in telehealth. So speech pathologists often use a concept called, barriers. So we might have a sabotage situation where we're requiring the client to describe something to us or get clarification because they haven't understood something. And so telehealth actually provides the ideal opportunity to work on those type of activities with the client. So yesterday I was working with a client, and this client doesn't give a lot of information. They don't describe things particularly well. So the fact that I wasn't in the room with the client and I was saying to her, describe to me, what does your bedroom look like? How many bookcases have you got? So she was actually having to provide me with detail because I wasn't there and I couldn't see what she was saying. And then at the end of the session, then she turned the camera around and she actually showed me, and she had actually been really quite accurate because it was a situation where she knew I couldn't see what was there, that she actually gave more detail. So we can continue to provide education to carers, and it provides an ideal opportunity because quite often the carer will be with the person at home, and we can talk to both of them about how to best facilitate communication. So we can provide carers with ideas on if the person is having naming difficulties and they're, how can you help them? Can you provide the person with some pen and paper so they can write down what they're trying to say? Can you provide them with some prompts, like what does it look like? So we can still provide all the education we would normally do. Voice therapy, we can provide that over telehealth. So working with clients on providing a good quality voice. Maybe if someone has voice difficulties and their voice is very hoarse, providing them with exercises and strategies to get good vocal quality. And as Aimee mentioned, for some clients, the telehealth provides a good opportunity to do, more frequent sessions, which actually helps them to embed those gains that they've made and continue, moving forward during this time of COVID, rather than sort of stopping therapy and then clients, potentially regressing. We're able to keep moving forward and helping them to maintain their motivation and to, maintain the gains. There's a lot of websites, so part of the interactiveness of using telehealth is we can, work with the client, showing them YouTube videos, then getting them to describe what's happening, or working with some interactive games. Telehealth, in particular, when we're using, the video aspect, it's fantastic for working with someone that might have some social difficulties, because we're actually giving them the opportunities to, look at someone's facial expression, to, take turns in conversation. When in telehealth, you can't overtalk each other, you end up with a blurred noise. So it actually requires us to wait and to take turns really well. So that is something that we can do. For some of our clients, they might use communication devices. So they might use an iPad that has an app, a communication app on it. And our fantastic tech-savvy speech pathologists in particular, Jasmine and Aimee, have found out a way that the speech pathologist can actually get their iPad and link it through telehealth and show the client what's on their iPad, and then the client can actually see what they're selecting on, what the speech pathologist is selecting on the speech pathologist's iPad, so that then they can copy that themselves. And that's just amazing, because really, who would have thought a couple of years ago that we could do something as fantastic as that? So if someone doesn't have verbal communication, that doesn't mean that we can't use telehealth. We can still use keyword sign over telehealth and, work with the support workers around showing them keyword signs that, and then they can also model with the client when we're not there. So, there's many, many opportunities for us to continue working with our clients and maintaining our goals. We move to the next one. Yeah, so dietetic services are also provided by telehealth, and the dietitians, you know, can still do the same analysis that they would do face to face. So finding out what a person's normal diet might look like in regards to what they might have for breakfast and what they have for lunch, what they have for dinner, talking about their meal plans and their shopping. Telehealth provides a good opportunity where the client can actually, you know, show the dietitian maybe what's in their fridge, what's in their cupboard. Maybe they have prepared their lunch, as Aimee mentioned before. Then the dietitian can actually see, well, you know, what size serves has the person got on their plate. They can still, you know, do all the food work analysis that they currently do, and providing education over telehealth, so, you know, face to face or via phone. And they can continue to do, you know, develop the resources, providing those to the clients and emailing them out or sending them out. With all of the services, you know, where possible, we encourage family members to be involved. So, you know, the same with dietetics, encouraging family members to be present as part of that assessment, and, you know, education can be provided. So, you know, what might be appropriate diet choices, you know, what might be some things that the client might be able to substitute, maybe a less healthy choice with something which is a better healthy choice. Helping the clients to read food labels, you know, that can be done. You know, if the client has the food item there and can hold it up to the screen, then, you know, the client and the dietitian can both see what's on that food item, and reviewing food diaries. So, you know, all of the services that are available face to face are still available. You know, the dietitian might ask a couple of different questions. You know, how do your clothes feel on you? You know, do your clothes feel a little bit loose? Do you think, you know, that you've lost weight, and things like that.
Great, thanks very much, Nick. Aimee, this is your slide. Okay, so let me continue on this one. So if clients still require a home visit, we are an essential service, so we can still go into the community at this stage with full PPE. We do the risk assessment over the phone, over text, and before we actually enter the home, to make sure that we are not putting anyone at risk and no one in the household is putting us at risk, so we can continue with our essential services. So we maintain a high level of protocol to make sure that it's usable. So we will continue to clean our hands thoroughly, sing happy birthday twice as we do so, to cover our nose, our mouth, you know, cough into our elbow, avoiding close contact, maintaining that 2 meters, and when we do need to come into close contact, such as swallowing assessments, to make sure that we have full PPE in place. And of course, if anyone is sick, they stay at home. So the preference now in this climate is to have all sessions as much as possible via telepractice, but we understand that that isn't possible in all cases. So we're very keen to talk to people and work with people on how we can tailor a service for you. Sometimes an initial visit, and keeping those visits shorter, like Aimee and Nick have explained, if we do need to do that face-to-face visit. But we are still determined and doing everything we can to continue services as much as possible. We found...
My internet just froze, and that's just showing the importance of flexibility in these times at the minute as well. So sometimes we might start something thinking it's going to be face-to-face, and then we end up converting. We get halfway out to the client's home, we call the client from our car and say, hey, we're going through our checklist of questions. Are you unwell? Have you been in touch with anyone that's got a confirmed case of COVID-19? And they say, well, yes, my XYZ has just come back from overseas, or my nephew's just been diagnosed. And we say, okay, well, that means we can't actually continue the session face-to-face today. So how about we conduct it over the phone instead? Or do you have a computer? So we're all about being flexible and helping our clients be as flexible as possible so that we don't have to cancel sessions and we can continue to help them meet their goals and prevent that isolation. So yeah, it's just me being as flexible as possible in the background and booting any children that I have off the computer and internet to ensure that I can continue. Sorry about that.
Yeah, that's fine. It's something that we're dealing with day to day, and it is necessary always to have a plan B for our sessions. So a lot of preparation to make sure that our telepractice sessions are as successful as possible. We do a lot of prep before the session. And part of that is that we have a plan B in case the internet or something like that fails. So we wanted to share this with you. It really tickled our fancy. So I'm just going to read it out to you. I will teach you in a room. I will teach you now on Zoom. I will teach you in your house. I will teach you with a mouse. I will teach you here and there. I will teach you because I care. So just do your very best and do not worry about the rest. It's very interesting times, and we are using a lot of Zoom, and this sums it up very nicely. Okay, so that brings us to our question time. I'm just going to stop sharing the PowerPoint presentation now so I can look at those questions. Okay. So we have a question here. Are people able to access using care plans, and is there any gap payment needed? Okay, so as we might all be aware now that, that these are care plans, so the EPCs or the CDMs, whatever you like to call them, they are now also available for telepractice, so we can provide them over telepractice instead of face-to-face. So at this time, we would recommend people call us. There are some sessions, you know, they provide up to 20 minutes per session, so it really depends on individual needs. More than likely that initial assessment will need to be longer, so there would need to be a gap payment there.
And also particular disciplines, we find it's not really suitable via CDM, mostly because CDMs can only be used for a face-to-face consult. So for anything, for example, occupational therapy, where there's often extensive paperwork required for equipment prescription. So for example, if we're doing an equipment request form via the government subsidised scheme, or if we're doing home modification requests, all of that paperwork time generally isn't done in front of the client. That's done separately. And the CDM, or an EPC, should I say, basically only covers you for the time that you're sitting face to face. You can't actually use a second session for paperwork time or for anything else if you look at the MBS guidelines. So yeah, it means that we have 20 minutes to sit with the client and complete sometimes 14 or 15 pages worth of paperwork. So it's not actually a feasible option for OTs to complete. So generally it tends to be our physiotherapy and exercise physiology services that are looking at providing those services under EPC or CDM.
Yeah, and with that, Aimee, we also received advice from the Department of Veterans Affairs yesterday. So now for veterans, we can provide services online as well, which is great news for particularly the elderly population. We can stay connected to them in their home. So that was a really big win, a big relief for all our clients and our clinicians, that we can continue on that valuable service. So we have another question here. It is about our Zoom, using it as a mode of telepractice. Is it the most secure and reliable? And can we confirm what version of Zoom we are using? So we've definitely found it to be the most stable and reliable. The current, having this webinar presentation, that is an additional membership fee that we pay. And we have a paid account that we run all our sessions for, where we're recording them, or if they go over 40 minutes. The free ones, you have to, it is limited. You can't record if it is more than 3 people for and going over 40 minutes. So we opt for the paid one. As to whether it's Zoom Pro, that version, it is, yeah. So we're on Zoom Pro. Okay, another question. Just wondering, so that was from Jessica, so thanks Jessica for that. From Angela, thanks for joining us. She's wondering if we have any additional tips for home assessments with elderly clients who have limited knowledge or access to technology. Some don't have mobile phones or internet. Ideas and ways that we can still service these clients who are more vulnerable.
Yeah. So did you want me to take that one?
Take it away, Aimee. Yes, please.
Yep. Yeah, so for a lot of those clients, we're even offering, so for us in particular, looking at, say, our Veterans Affairs client group, because we do have a lot of Veterans Affairs clients, and in preparation for the option of being able to provide telepractice, we are looking at, for example, being able to offer it as a telehealth service, so something that is over the phone, where we're looking at even still being able to offer for those that are technologically challenged, and there will be many in that age bracket that are technologically challenged, a portion that is over the phone and a portion that still remains needing to be face-to-face using the PPE. So the other thing that we can look at doing is also talking to them about if there is a time when a usual family member does come to visit them, scheduling a time with a usual family member. Often they may have a family member that is coming to visit them that does have an iPad or an iPhone or a mobile phone, like a smartphone, those kinds of things, that would be prepared to do that session with them in that way. So we are looking at doing those kinds of options as well. So it's often about having those conversations with them. Most of our therapists are looking at, particularly with our older clients, in a face-to-face session before just jumping into phoning them and saying, hey, how about we do X, Y, Z, having a face-to-face session with them using all of the PPE and saying, look, we don't know where this situation is going at the moment, so we'd like to actually discuss what options we have now, and actually talking them through that process now while they can be sitting there with them and it's not so scary, and say, do you have this available? Do you have that available? Well, I'm here. Why don't we download Zoom now on your computer if you've got a computer? If you don't, but you've got a tablet, why don't we do it on the tablet and I'll show you how that works? And they're actually setting it up with the client in their home and then saying, okay, I'm going to go and sit on your front veranda and I'm going to talk to you via this while I'm sitting on your front veranda so you can see how it feels. And actually doing that as part of their face-to-face session with the client now, so that it is part of that last maybe face-to-face session and setting them up so they feel comfortable. It doesn't have to be this immediate severage, because we do still have that essential service status. We can still get in to see the clients now. While we've still got that capability, actually ease them into this. Get them used to the idea, help set them up so that if it does change, or when it does change, we can have that nice segue into what we need to do for this population and this group. So that's definitely something that we're helping all of our clinicians with now, and as many of our clients as we possibly can.
Great.
I hope that helps.
So keep those questions coming. I see we've got a couple of minutes left. There's a question here from Yultendra Verma. She has a question for Aimee. Unfortunately, I can't bring you in, so we can't hear you. If you wanted to type in that question, Aimee can answer that for you. Otherwise, there was another good question. Let's see. Okay. Looking at the privacy, so can clients, this is from Cassandra, thanks Cassandra, can clients participating see other clients for the group style, just considering any privacy issues for paediatric settings? So
no, when the clients are participating in a group session, they can all turn their video off. So I'll give you an example of what I mean here. So I've just turned my video off. So anybody at any time can turn their video off the same way they can turn. Okay, So any client at any time can turn their video and their audio off. So we can definitely provide that instruction. So if you create a webinar, as we've done today, we can't actually see any of the participants and we can't hear any of the participants. So what we can actually instruct when we're providing group sessions is we can turn the videos off, but instruct clients to leave their microphones on as they want to chat with other participants. So it can allow the social connectedness via voice, but without the video image in the background. So we can offer that option as well. So it's really up to the individual participant how much they want to disclose or participate in that session.
Okay, and another question, Aimee, this might be for you. Are you able to complete functional capacity assessments via Telepractice?
So if you're talking about functional capacity with regards to, say, a return to work or something like that, that's not an area that we actually cover at Recovery Station. So it's not something that we would do. In terms of the level of assessment that we look at the moment, we complete as much as we can via Telepractice. And if there's something that we feel we haven't covered as in-depthly as we need to, we would still then say, for that section, I feel I need to actually come out and do it face-to-face. I'm going to use my PPE. So, and this is again where we use that. I'm going to drive up to the client's home. I'm going to call them while I'm sitting out the front and I'm going to say my 3 questions. You know, morning, how you going? I just need to ask you these questions as part of our usual safety routine now. Number 1, have you just returned from overseas and are you in isolation? Number 2, have you had contact with anybody in the last 14 days that has a confirmed diagnosis of COVID-19? Number 3 is, do you have any flu-like symptoms? If they answer no to all those questions, then we can go ahead with the visit, but at the same time, we let them know that as an essential service provider, we can come into their home if they're happy with that, but we do have additional PPE at the minute, personal protective equipment, such as our gloves and our mask. We're doing this to ensure their safety and our safety so that they know we're not, you know, we're not the hazmat team. We don't mean to scare them. We're just doing this so that we're preventing any spread of any infection or illness, and it's part of what New South Wales Health and the government are saying we need to do at this time.
Great.
It's ensuring they're comfortable.
Great. I can just see time's getting on. So just a couple more questions that we did have in. Let's see. So that was a question from Andrea. So thank you. Okay. So looking at the new line items for NDIS for phone contact as a cause, do I need to alert participants about amendments to service agreement? So that's from Jenny Hinton. Thank you. Yes. So as you would be aware for NDIS, they have provided for a 10% price limit to existing the price guide fees for certain services, including all the ones that we provide. So we have applied the 10%, and according to our service agreements, it does make amendments in there if we do follow what NDIS has instructed us our possibilities to do. We have also reached out to all our participants, all our clients, to let them know what we're doing. In terms of the cancellation fees, that is now at 100%. We have not, so 100% of the cancellation fee. However, we have not put in place the 2-week notice. So we've kept that at 2 days notice. Also, we've been advised by the NDIS, if people are finding that their funds are running low and they need some more funding for therapy to continue to get to their goals, that they can go for an early plan review. So that is how the NDIS are managing the 10% increase. They're looking at it to see whether it's feasible at this time. But importantly, that 10% increase does make a massive difference to services to make sure that we remain viable. As you can imagine, like our diaries aren't as full as they used to be. So for us to come out of this stronger, more viable, it is important that we have a full team coming out the other side of that, and we're doing everything we possibly can. So thanks, Jenny. And also Leanne, you asked what's our current waiting list on the Central Coast for OT and speech. So leading on from that, we have good availability and we're actually strengthening the team at the moment. We do have new staff. Tell us about our new staff, Aimee.
Sorry. All of you having to witness my happy dance there, I'm very sorry. But we just have a new speech pathologist for the Central Coast about to start with us, and we have a new mental health OT starting in the Hunter, which will give us more availability in the Central Coast and the Hunter region. So I'm very excited about that. So our team is continuing to grow even during this time period because we do have lots and lots of clients and we want to provide the best service we possibly can. Another very quick point is that, as you would know, for our NDIS participants, all of the plan review meetings face-to-face have now been transitioned over to telephone meetings wherever they can, and also they're doing plan rollovers as much as possible. So our aim and mission right now is to provide for all of our NDIS clients plan review reports where we can, so that we're ensuring if clients were not happy with their previous NDIS plan and they need additional funding in their next NDIS plan, they can take that to the NDIS or send it through to their planners or their LACs and say, look, we do understand what's happening right now, but please review this report within that plan while you're writing this new plan, and make sure that I'm not just getting a rollover, that I am having some additional funding added into my next plan, because I think quite a few people may be unhappy with just that rollover principle. So we are trying to make sure that may be why a lot of clients are getting phone calls at the minute to say, hey, we're trying to do your plan review report. That's what we're trying to make sure of.
Great, thank you, Aimee. And before we end, I can see we're going over here. Nick, did you have anything to add?
No, just that, you know, telehealth has been a fantastic opportunity to keep our clients engaged, you know, and to continue to provide services during this unsettling time for clients, you know, to help them to continue to, you know, move forward. And, you know, it's fabulous as an organisation because we've all embraced it wholeheartedly.
Yeah, great. Thank you so much. Thank you to our panelists. And we asked ourselves the question, where to from here? So we hope that you've enjoyed this Q&A panel. We are available and we're willing to help your organisations, your staff. If you want some individual group training sessions, we can come in as a panel to help with your team, answer any questions. You might have more specific questions to the clients that you serve, so we can get to the nitty-gritty of things a little bit more with you. If you want to bring us into a team meeting, we will be there virtually for you. We look forward to working with you all through this time, and we're open to suggestions on anything else that we can do to develop resources to help you, to help your clients, so we can get through this time. It's just an incredible time that we're experiencing, and it feels like we're moving mountains to do everything we can to keep connected and supported, and to be here for everyone if they need us. Therapy can often feel, you know, when you're looking at surviving sometimes, but therapy can definitely help keep the mind off, and people can help connecting and reaching their goals. So it's an absolute privilege and a pleasure working with all our wonderful referral networks out there, and we're here to help. So thanks everyone. Thanks for joining us for our first Q&A panel, and we hope to see you here for the next one. I can see there's been a lot more questions come in, and we will get back to you personally. We want to help and we want to hear from you. So thank you, take care, and we'll see you next time. Okay, bye everyone.
Bye.